just to hear that noise. I've never heard that.
It's a sound Tucker Leonard wanted to hear his entire life. Tucker's worked in commercial construction since high school, so he's used to working with his hands. Unfortunately, work was harder for him because of excessive sweating on his palms.
It's a pretty miserable thing to live with. Nobody can believe it until you've lived it.
Tucker had a condition called primary palmoplantar hyperhidrosis. The condition occurs when faulty nerve signals located near the third rib trigger eccrine sweat glands to become overactive. In Tucker's case, it affected his hands.
It impacts them because the hands are involved in nearly everything that you do. The hands are so wet that they feel very embarrassed about it.
Tucker found ways to mask the sweating while on the job site.
I was always carrying a towel or something or leaving to dry my hands. I basically needed a pair of work gloves.
The sweating also took a toll on Tucker's interactions with others, especially when he was promoted to an office position.
You don't want to shake hands with people. It's avoidance. There's no excuse you can give. It gets pretty rough.
MU Healthcare Dr. Sebastian Weissman performed a minimally invasive procedure called endoscopic thoracic sympathectomy, or ETS, to fix Tucker's problem.
We go in with 2 very small trocars in between the ribs, and then we put a camera into the chest, and then we can identify the nerve that we need to cut. The moment that we cut the nerve, the hand immediately gets dry.
With one 15-minute procedure, the condition that plagued Tucker for 4 decades was fixed. Tucker is amazed how much his life has improved.
Both professionally and personally is a tenfold better.
Tucker remembers the first thing he did when he awoke from surgery.
I just wanted to hurry up and hold my wife's hand. Probably one of the things that I was wanting to get the surgery for the most.
For University of Missouri Healthcare, I'm Meg Judy.